Hello, I'm Brandy Whitley, Senior VP of Compliance and Clinical Initiatives for MasVida Health. Today we will be covering an overview of effective wound care, the benefits of negative pressure wound therapy, and demonstrations of both traditional and single-use negative pressure wound therapy products. So let's get started. As per cms.gov, the definition of wound care involves the evaluation and treatment of a wound, including identifying potential causes of delayed wound healing and the modification of treatment when indicated. There's 4 layers of the skin. The first layer is your epidermis, outer surface of the skin. Next is dermis, the layer directly beneath the epidermis. Subcutaneous, the tissue containing fat beneath the dermis. And then muscle. For definition and types of wounds, a wound is defined as an injury to the skin or underlying tissue causing disruption in the integrity or function of the skin. The types of wounds are acute, an injury to the skin that occurs suddenly. Partial thickness, when the tissue injury is extended only into the first 2 layers of the skin, which is the dermis and epidermis. Full thickness, when the tissue injury is extended into the subcutaneous layer or the muscle or bone. And then chronic, when it fails to progress within the parameters of the phases of wound healing, prolonged healing which does not have predictable timeline. Phases of wound healing. Every wound must go through the 4 phases of healing in order to be considered healed. 1. Hemostasis occurs within minutes of the initial injury. Bleeding is stopped, must be achieved within a 24-hour period for optimal wound healing. Number 2. Inflammation presents as arrhythmia, swelling, and warm, which often associates with pain, usually lasts up to 4 to 7 days post-injury. Number 3. Proliferation starts approximately 4 days after the injury and usually lasts until day 21 in acute wounds. Clinically characterized by the presence of granulation in the wound base and involved contraction of the wound. Starts with active granulation and it ends with 100% re-epithelialization or closure. Number 4, maturation, remodeling. Starts once the 100% closure or re-epithelialization is achieved. It must last up to 2 years after the injury, and wounds are considered healed upon the completion of this phase. The use of negative pressure wound therapy for complex and large wounds has increased in popularity over the past decade. Modern negative pressure wound therapy systems consist of an open pore foam sponge, adhesive dressing, and a vacuum pump producing negative pressure. There are multiple models on the market today. Depending upon the clinician preference, negative pressure wound therapy can be delivered as continuous pressure or non-continuous pressure. Only 2 types of non-continuous pressure exist currently. Intermittent, which negative pressure alternates between a set pressure and no pressure for programmed periods of time. Variable, which negative pressure transitions between a high pressure and a low pressure following a programmed rise and fall time. The psychological benefits of negative pressure wound therapy provides a moist wound environment, increases perfusion, promotes growth factors, removes slough and debris, contracts and remodels tissue, reduces edema and wound fluids. Other benefits is a faster healing time, reduced risk of infection, improves patient comfort, and therapy can be tailored to the individual needs of the patient, considering factors such as type of wound and the patient's overall health status. There is certain criteria that must be met prior to receiving negative pressure wound therapy, including documented wound measurements, treatments with moist dressings, adequate nutrition, debridement of necrotic tissue, appropriate positioning, elevation, appropriate diabetic care when necessary. Indications for negative pressure would include chronic wounds, acute, subacute, traumatic, partial thickness burns, ulcers such as diabetic, venous, or pressure, flaps, and grafts. There has been numerous studies that have demonstrated their benefits of negative pressure in accelerating wound healing and reducing the risk of infection. For instance, a systematic review of clinical trials found that patients treated with negative pressure wound therapy were more likely to achieve complete wound closure compared to those receiving standard wound care. Negative pressure is particularly effective for complex wounds that are non-healing, such as diabetic foot ulcers or skin grafts. Contraindications for negative pressure are untreated osteomyelitis, necrotic tissue that's greater than 20%, exposed vessels, organs, or nerves, wound malignancy, unexplored fistulas, or non-enteric fistulas. Thank you for watching our series on negative pressure wound therapy. If you have any questions or concerns, please don't hesitate to call or email our customer success team.